My name is Dr. Chill at New England Endovascular Center, and I'm going to discuss hemorrhoid artery embolization for the treatment of symptomatic internal hemorrhoids. Hemorrhoids are dilated veins in and around the anus and rectum. When the dilated veins are just outside of the anus, it is termed external hemorrhoids, and these typically present with pain and itching. When the dilated veins are inside of the rectum, it is termed internal hemorrhoids. Internal hemorrhoids don't always present with symptoms, but when they do, the most common presenting symptom is painless bleeding. The bleeding can be anywhere from mild to severe. Occasionally, the tissue from the internal hemorrhoid can protrude outside the anus, and when this occurs, it is termed prolapse. Prolapse can come with pain. Hemorrhoidal disease is extremely common, and up to 60% of Americans will experience it at some point in their life. The most common presenting age is between 45 and 65, but it can present at any age. The initial management for hemorrhoidal disease is typically with lifestyle modification, including a diet high in fiber, as well as stool softeners, and avoiding sitting on the toilet for excess period of time. For patients who remain symptomatic following these measures, there are treatment options available. Here at New England Endovascular Center, we offer a minimally invasive, state-of-the-art procedure called hemorrhoid artery embolization. This procedure is performed as an outpatient, meaning no hospital stay is required. The procedure is performed under moderate sedation, or twilight sleep. The entire procedure is performed through a tiny needle stick, either at the wrist or at the top of the leg, so no major incisions are required. During the procedure, a very small tube called a catheter is directed through the blood vessels and navigated under live X-ray guidance called fluoroscopy to the blood vessels which supply the hemorrhoids. Once the catheter is determined to be in the appropriate position, the treatment is delivered, and this consists of microscopic particles which serve to block the blood flow to the hemorrhoids. The vast majority of patients will experience a significant relief in their symptoms, and this can last for years. The recovery from this procedure is very quick. People can typically return back to work the following day and resume all of their normal activities within 1 week.